Welcome everyone to the second episode of All About Phage Therapy. We got a wonderful response for the first episode that we had last week. And I'd like to thank everyone who watched the session, the discussion session, and participated in it with your questions and comments. We are joined today by the head of the Eliava Institute from Tbilisi, Georgia, Dr. Mzia Kutateladze. She is the director of the almost 100-year-old Eliava Institute, and as her position where she oversees all the work of the Institute, she has great insights into the past, present, and future of phage therapy, which she's going to share with us today. Dr. Mzia, it's a pleasure to have you here. Welcome.
Thank you very much. First of all, thank you, Prana, for the invitation. It's really very interesting, very important idea. The more words about phages, about phage therapy. I would like to greet your audience, your listeners. So I'm ready to your questions. Thank you very much.
So to start our discussion about phage research, phage therapy, the world of phages, I'd request you to walk us through the entire history of the Eliava Institute. It's almost 100 years old, and the work with the bacteriophages must have gone through so many different evolutions, so much development over the last 97 years. So I request you to just give us a walk through this entire history of the Institute.
Thank you very much for this question. It's quite such a substantial history that only one our meeting will not be enough to describe all the developments. But I will try very briefly to tell you very briefly about the history. Yes. So the Institute really has a very interesting and substantial history. It's kind of pioneer in phage research and application. So again, as I told, we had in the country the station of Pasteur station, so-called, which was transformed into the Central Bacteriological Laboratory in 1916, and which was serving the entire region for research and diagnostic services. In 1918, Georgi Eliava, who was the young microbiologist and bacteriologist, he became director of the Central Bacteriological Laboratory. And very soon, in the 20s, he was sent by the government to Institute Pasteur in order to develop the vaccine works in Georgia. And in the Institute Pasteur, he met with Felix Direl, French-Canadian, who was already one of the discoverers of the phage phenomenon. So he was already working on phages, and he already has used the phages for treatment, and he was saving the lives of the people with the infectious diseases. And this is how Georgi Eliava became infected with the phages, bacteriophages, and he started works in bacteriophage research. So then these two scientists decided to create a World Center of Bacteriophage Research in Georgia. Felix Direl was invited by Georgi Eliava in Tbilisi. He has been here three times, in 1930, 1931. He had his own laboratory, he was working here. And this ambitious plan to create a center in bacteriophages was really very evident and very realistic. But unfortunately, in 1917, Eliava was arrested and executed like a people's enemy due to some unfavorable political situation. And Felix Direl never came back again to Georgia. Also, Institute developed under different authorities. Very soon, it became as one of the most famous and biggest institutions and biological centers in the former Soviet Union. So it was consisted two parts: scientific part where the most scientific research was developing, and the production facility. So the institute was producing not only bacteriophages, also it was the mainstream, but we were producing vaccines, also for some sera, some biological products for treatment and also identification of some bacterial diseases. But phages were really very important part and direction of the institute. So phages for treatment of human bacterial diseases. Also, phages have been used for prophylactic purposes in case of high incidence of development of infections, kind of outbreaks, and it was really a very important part of our activities. I could say that one of the biggest consumer of the phages in the Soviet Union, it was Soviet Army. And first of all, they were using phages for prophylactic purposes for diarrheal or intestinal problems. But again, phages were the standard part of the healthcare system in the Soviet Union. Production facility was really very big. I could say that about 200 tons per week, it was the whole production of the biological preparations. So it's a quite a big production. So then after the breakdown of the Soviet system in the early 90s, you know, the country itself and also our institute have met a lot of problems. So in one couple of days, you know, the institute lost the biggest market. So it was impossible to produce or to work in the same scale as it was before. Institute had a lot of problems with electricity, with the water supply systems, with the funding. So it was really very tough and very difficult time for all of us. But fortunately, the institute survived. First of all, so we should somehow to take the new step into the new reality. We'll have learned how to adapt to this new situation. We learned how to write the international proposals for the international funding. So it was really very difficult time, but Institute has survived. And I'm very happy to say that still we are really very I could say that we are leader in the phage research and also application as well. So this is very briefly.
Thank you for walking us through that really fascinating history. So it's gone through so many ups and downs. I mean, you said in 91, after the collapse of the Soviet Union, things were so difficult that even electricity and water supply was a problem. So I guess that the scientists who were in the Eliava Institute at that time would have played a very important role in making sure that it continued.
Absolutely, it was the biggest contribution of the scientists on the management that time. So this was really very important. You know, during the Soviet time, it was obligatory to send to the Eliava all bacterial samples isolated from the patients. And the institute were studying these bacterial samples, also selecting the active phages, bacteriophages, again, those bacterial samples. So this is why we had one of the biggest collection of the bacterial strain and also bacteriophages. So unfortunately, due to some problems, physical problems, our big part of the collection of bacterial strains have been destroyed, but we still have one of the biggest collection of bacteriophages. The scientists themselves were keeping parts of the phage collection in their homes and in their home refrigerators, and it was really very big dedication of the scientists of the Eliava to save our phage collection.
That's so fascinating to know. I mean, it's such a big thing that those scientists must be thanked for making sure that we are today talking about phage therapy, and because Eliava Institute has really kept phage therapy alive over the last 100 years in a way. At which point did you get interested in bacteriophages? You know, when did you start working in this area of bacteriophages?
This is an interesting question. Actually, not very from the very beginning. So I have graduated from the Tbilisi State University, which was one of the biggest and most well-known universities here, so Faculty of Biology, and my interest was immunology and microbiology. So I came to the Eliava Institute to write my diploma thesis, and it was in immunology. And being here at the institute, then I decided that the bacteriophages were something very interesting, very attractive to work on. The institute was very famous, very traditional, and it was very strong center of research. So I started to work here as a lab technician, and I passed through all the steps of development in my scientific career. So I was a junior scientist, and I defended my PhD thesis. I became the doctor of scientists. So it was a long way, but very interesting. Yeah.
So you started from the grassroots, and now you're the director of the Eliava Institute.
Yes, right? That's true.
So how long has your association with the Eliava Institute been? When did you start working?
It's about 30 years.
30 years, wow.
Yeah.
So currently, as the director of the institute, you oversee all the different parts of the work that the institute does, including the research work. So what's some of the new bacteriophage research work that's happening at the institute that you're most excited about, that you think will be very exciting for the world, and that you personally feel most excited about?
Thank you for this question. The institute is working into the different directions, of course. First of all, the mainstream is the human therapy. So we have a couple of very interesting projects in collaboration with our foreign partners. I would like to mention one very interesting project, for example, which is funded by European Union. It's a Horizon 2020 grant to identify the role of the phage in development of the asthma in children. So it's really very interesting project, and we have already some preliminary results. The other project also to construct the new phage preparations for the bacterial diseases that are caused by gram-negatives. Also, it's in collaboration with our French partners. Also very interesting for us in partnership with the US-based scientists and scientists from Switzerland to find phages and to prove the concept of phage application in bacteria against bacterial diseases in the women's reproductive systems. So it's a lot of activities going on. We have also a lot of data in our phage therapy clinic of the patients who have been treated over times with the phages. And so we would like very much, and we are it's ongoing process to characterize and to analyze the data of those patients treated by phages. So it's a lot of activities for the human therapy. The other very interesting for us area, it's phages for veterinary application. Also, we are establishing the new preparation phages for infections in poultry right now. Also, we are working on phages for fish diseases in aquaculture. So it's also very interesting for us for the scientific, also for commercialization point of view. Besides, we are working on the environmental monitoring to identify the role of phages, temperate phages, it's a different phages, in the spread of antibiotic resistance in the different ecosystems. First of all, it's a water ecosystems. Also, we are working on probiotics. So it's a great variety of the projects and activities right now going at the Eliava.
So the temperate phages that you just mentioned, those would be the non-lytic phages, the lysogenic phages, right?
Yes, that's right. So it's phages are two different types. Lytic, which in any circumstances cause the death, they're killing the host bacteria, but the temperate phages, which are incorporated into the host bacteria, and they can transfer some kind of properties for the host bacteria. It's really very important and interesting for the scientific perspective, but we are not using temperate phages for treatment.
So you spoke to us about the 100-year-old history of phage therapy at the Eliava Institute. I would like to know from you a perspective on how people in Georgia look at phage therapy, because for a lot of people from outside Georgia, phage therapy is something very new. It's not something that they know of. It's not something that's been part of their life growing up, and it's not been part of their life. But for Georgians, is it different? Is it been much more part of the life of Georgians? So for example, if someone in Georgia has a lung infection or a throat infection, is it very normal for them to go and get tested at the Eliava Institute and take phages for that infection?
Yeah, absolutely. As I mentioned, it was the standard part of the healthcare system during the Soviet time. Also, the institute had the very famous and big name, kind of brand name, and everybody knows about our institute, Phage Institute. So, and people even without doctors, so going to doctors by themselves, they're coming to us, they identify the pathogen and they're using phages without prescription of the doctors. As for the doctors and medical system, it very much depends on doctor, what is the decision. So it depends, of course, on the medical status and medical complications. So how doctor makes decision which one should be the first. Yeah, so there are some cases that only antibiotics, you can use only antibiotics, but most of the cases you can use the phages as well, or the combination application with phages plus antibiotics. So it's very much, of course, we have the European guideline, and the first line is the antibiotics. But again, it's very much depends on doctor and patient itself.
One of the things that I have seen, and I can mention it right now, which I've seen at the Eliava Institute, is that a lot of locals even bring their children to the phage clinic for treatment. So that is a very big sign of how people in Georgia consider phage therapy, because they're even, for their kids, if they have a problem, they'll bring the children to the clinic for treatment.
Absolutely, you're absolutely right. Yes, for children, we are using the phages for the many complications, for intestinal problems, for diarrheal diseases, for tonsillitis. So it's a quite a normal approach for treatment, yeah, absolutely.
And jumping from local to global, there's been a big increase in the interest in phage therapy across the world in the last few years. There have been a few cases of people who had antibiotic-resistant infections, like myself, and people were able to overcome those infections with phages. And some people's cases have been covered quite widely by the media, and there's been an increasing interest in phage therapy. So have you seen that having an effect in terms of the number of people who come to the institute for treatment, the number of people who come to the Eliava clinic for treatment, and the number of people who are contacting you for for treatment, for research? Has there been a growing interest around the world?
Yeah, absolutely. When I remember the last times, for example, 25 years ago, and when me and my colleagues were presenting about our data or results of our phage application for treatment on the conferences, international meetings and workshops, we were getting quite a skepticism from the different doctors and the audience, because first of all, it was the fear that, they are treating infections with viruses. So it was quite an interesting and lack of information in general, But over the time, the interest have been developed. The more and more information about already phage-treated patients, case description have been published. We were presenting our data more and more on the scientific conferences during a lot of meetings, and I can say that number of patients are increasing every year. So first of our international patient, I remember we had from Canada in 2000. And then after 2000, we had sporadic number of the patients coming to us. But in 2000, then it became the numbers like hundreds and hundreds per year. In 2018, the number doubled. Actually, number of patients in 2019, it's already tripled. For today, I can say that, so we still do not have thousands because we have very small outpatient clinic, but we have about 30, 40 patients per month, which is really very important to us, for us. And this is international patients, so patients who are coming from the different countries. But also we are treating the local population as well. So let me just give you the current situation what we have here, if you just let me do it. So for the patients, and it's very important what we have here. We have not only the institute, Eliava Institute, which is mainly focused on the scientific research. All the scientific projects we are performing in the institute, but we have kind of consortium, all kind of services which is needed for the patient we have on the same side. So for example, patient is coming to us, we have diagnostic center here where it is possible to identify the pathogen, bacterial causative agent, then to select the active phages, bacteriophage preparation. Then the second, very important for us, we have production facility here. So we are producing 6 different products right now. So 5 are mixtures of different phages, and 1 is only monophage, 1 staphylococcal phage. So and we are selling our product in our pharmacy, which is again on the same side. And the most important thing also what we are doing here, so in case we have patient where the commercially, so-called commercially available phages do not work, then the institute is selecting and preparing the specific autophage, so-called autophage, for personalized approach and treatment of the for the patient. And our pharmacy has special license to sell and to give it to the patients. And the last, very important, we have also Phage Therapy Center here, which provides the complete medical service to the patients, including diagnostic services, including the phages, phage commercially available phages, also autophages, and also treatment. We have doctors here. So you have all the services and products on the same site, and it's really very important and easy available to the patient.
I think that's a very important point that you spoke about, Dr. Mzia, because for many people, and this is true for many parts of the world, antibiotics are often prescribed without a lot of testing having been done. They are prescribed empirically. But with phages, it's very important to do very exact diagnostic testing because they are very specific in nature. Mm-hmm. They're not very broad-based. So it's important to do diagnostic testing before phages. And when a patient comes to the Eliava clinic, they're able to get all of those kind of services all in one place. And that's something which often people sometimes, because the mindset is so trained on thinking along the lines of antibiotics, people sometimes don't necessarily realize that you have to do that diagnostic testing and identifying the sensitivities before taking phages.
Yeah, absolutely. It's very important because as we know, phages are very specific. And it's kind of advantage over to the antibiotics because they selectively identify and kill the host bacteria. So this is why it's absolutely routine for us and absolutely necessary to select appropriate phage to the specific pathogen or pathogens, because in most of the cases are clinical infectious complications are mixed infections. So we identify pathogens and we select the active phages against that.
And what are some of the most common conditions that you see amongst the people who come to the clinic, amongst both the international patients as well as the local patients?
Yeah, different, absolutely different. For the locals, you know, mostly it's acute complications, you know, diarrheal diseases, some intestinal problems, and also chronic for the local population. But for the international patients, mostly it's a chronic diseases of different systems, you know, urinary tract infections, gynecological infections, wound infections, you know, infectious wounds, including the diabetic ulcers, post-operational wounds, also very important target for the phages. We are dealing with the cystic fibrosis, which is very important for us. We started it, it was kind of non-traditional disease for us. We started to study the pathogens and also using phages for CFA patients recently, maybe 10, 15 years ago, and we have very good results after phage application. So different variety of the infections. Where we are dealing with phages.
So it's more chronic conditions for international patients and locals
Absolutely.
coming in more for acute conditions.
Yeah, both. Locals with both acute
Chronic.
and chronic, yes. But the international patients, mostly chronic infections.
In your work as the director of the Eliava Institute, you would be interacting a lot with medical regulators, with other research institutions around the world. Currently, the entire world is going through a pandemic, which is being caused by the COVID-19 coronavirus. Do you think that this is going to lead to more resources being devoted towards medical research, towards healthcare by governments and by institutions around the world? Because people are realizing that the entire world can come to a standstill by a microorganism. So do you think that this will lead to more funding and more resources being allocated to this research, including research?
Yeah, sorry. This is very interesting question, important question. Thank you. Yes, actually, we see during these pandemics that many countries are ready to provide more financial contribution to the science, including the approaches, antivirals or vaccine developments. You know that a lot of groups in many different countries are working in this direction. Of course, and we all know that this virus is not the last one we will face too. And we also know the antibiotic resistance is still here. I mean, it didn't disappear. It's a bacterial infections also are here, and it will gain more and more attention from the officials. I think and I hope that the concept of funding, concept of decision-making processes, it will change a little bit. Even the secondary bacterial infections that are associated with the COVID-19 are really very, very problematic. You know, it's a very interesting data we are reading from the different countries that the bacteria associated with the COVID are quite different. They're different from hospital to hospital even, not from the country to country. And this is also very interesting area because the pneumonias are mostly caused by the bacteria. So this is also very interesting and important topic of investigation, and many others. So I hope very much that it will be increased financial contribution from the officials, for the legal authorities to the science, including the struggle against antibiotic resistance.
That's actually a really important point that you're bringing up about the secondary infections with COVID-19, because many people are suffering from respiratory infections, which are secondary infections caused by bacteria. And you said that there's big differences. So are the resistance patterns also quite high with the bacteria that is being associated with COVID-19?
Absolutely, yes. You know, actually, I do not have the data on antibiotic resistance, but how it is high in comparison to the other data which is not associated with the COVID. But still, it's different pathogens, including a lot of intracellular pathogens, which, for example, it's very difficult, impossible to treat by phages. But still, there are common pathogens as well, like Streptococcus pneumonia or even Staph aureus and different kind of Streptococcus. So it's really very interesting topic. A lot of interesting data are coming, but you know, we will have more analysis of the data which we will get from the different countries, and many scientists will do it, and then we will have more clear picture what we can do.
We started this discussion talking about the history of the Eliava Institute, and you gave us a very nice walkthrough that history. One of the things that came out has been that Eliava Institute over the last 100 years has been at the forefront of bacteriophage work and bacteriophage research. Now, in the last few years, as you mentioned, that the interest in phage therapy and phage research has really gone up, and many institutes and many companies are getting into this field of bacteriophage research and creating phage-based cocktails or phage-based medicines. What are the steps that the Eliava Institute is going to take to remain at the forefront of phage research and phage therapy over the next coming decades?
Yes, Eliava, as I already mentioned, it's a pioneer in this research and application. So we have quite a knowledge, experience, which was passing through the generations here. And I think that we have still a lot of understanding of phage, a lot of knowledge how to treat patients. So I think that more international collaboration will be developed, because you know that it is not approved by any countries yet for the massive application. Also that there are a lot of companies, also academic institutions in the US, also in Europe, they are working in order to get this approval. First of all, very crucial is to have the clinical trials according to the internationally approved standards and protocols. There have been a couple of them, but still there is no clear understanding how it should be. So I think, and I see the role of the Eliava to participate into this clinical trials together with our foreign partners, because there are a lot of minor, small details, and details are very, very important. And the new companies should not spend too much time to develop, to understand these details. And Eliava knows all this. In general, it's very difficult when Georgia is a very small country, as I mentioned at the beginning. We are less than 4 million. We are not part of the EU yet, so it's really very difficult to go directly to the authorities, legal authorities outside. But we have some plans. We are trying to approach them together with our international collaborators and partners. So I think that Eliava is a really very important name. It's a brand name. It's not easy to keep this name, but we are trying our best. And I hope that we will do, and we will develop more again in collaboration with our partners in the different countries.
For patients who have been able to overcome their infections with phage therapy, like people like me, it's something that we wish all the best for future endeavors to Eliava Institute. And we hope that the research continues and the application of that research keeps becoming wider and wider, so that more and more conditions can be treated with the bacteriophages.
Thank you very much. It's really very, very important for us, the opinion from our patients. It's really very important that even understanding that we are helping people, trust me, it's really very important for us. feedback from our patients. Our Phage Therapy Center tries to collect all the information from our previous patients in order to find out how they're doing. Do they need some additional care and phages, because mainly these are the chronic patients. And I hope very much that we will continue. Maybe in the larger scale. We will be able to enlarge and expand our Phage Therapy Center, and we will be able to help more patients. So this is our target in the nearest future as well.
It's good you mentioned that, because that was going to be my next question, that what do you see as the landscape for phage therapy, phage research, both at the Eliava Institute over the next 5 to 10 years, as well as globally, because you interact so much with the medical associations, with the regulators, with the institutes all around the world. So what do you see as the future landscape for phage therapy, both in Eliava Institute as well as across the world?
So, you know, the process has been started already. So we see the more and more developments, and there are more and more clinical trials, for example, approved in the US for the human therapy. This is also very encouraging, and it's moving. It's a lot of developments in EU. Different countries, first of all in Belgium, in Germany, in Netherlands. So it's a lot of activities ongoing on. So as a target for the Eliava, again, I mentioned, and we are going to expand our activities for the to treat and to provide our service to more patients approaching to us. Also, our next goal is to develop our production facility to more international standards. This is our target, and we are going to that direction. Also, more international collaboration, as I mentioned, and I think it will become more attractive to the doctors as well, because as you are spreading more results, more successful cases, we are publishing, we are at least trying to publish more and more case descriptions of our patients, you know, and all this in package, it will develop more and more the extensive application of phages in many countries.
That's really good to know. So the capacity for having treatment given out will be increasing, both from production facility as well as from the clinic capacity in terms of patient treatments. That's good.
Absolutely. Absolutely.
We have a lot of people who are watching this session, Dr. Mzia, and they have sent in some questions. So I'd like to put some of those questions to you. I'll read out the names and the questions that we have received. We have a question from Atif Khan, who asks that, can phages cross the blood-brain or blood-testis barrier?
Yes, actually, yes. There are some publications, very interesting publications describing this phenomenon. You can see the phages after the treatment crossing the barrier. And if you have the email of this person, and we can support with the publication, we can send the links or references to this person. Yeah.
Atif, you can get in touch with us, and we'll be able to, as Dr. Mzia is saying, we'll be able to send out the publication to you for that. We have a question from Raghav Mehta. He would like to know that, is it possible that phage research in the former Soviet Union continued because Western Europe and America adopted antibiotics as the primary treatment?
I'm sorry, I couldn't get the question. So
it's about the history. So he's asking that, is it the reason that phage research continued in such a strong way in the former Soviet Union? Is it because the West, the United States and Western Europe, adopted antibiotics as their main line of treatment?
Okay, it's an interesting question. Actually, before 40s, there were a lot of research and even application of bacteriophages in different countries. First of all, it was France. They were producing 5 different phage products. It was in Germany. 2 big companies were producing the phages for human therapy. Also very interesting that in the US, several companies, first of all, it was Eli Lilly, which was producing 7 different products for veterinary application and human therapy. So it was happening before the 40s, before adventing or whatever, the antibiotics. But there were a lot of problems why they did not continue. Why? Because the antibiotics were very successful, very effective. The second, it was kind of lack of understanding of phage biology. So it was kind of, they were using phages for everything, for even fungal diseases, for different complications, viral diseases, and of course, phages did not work in this case. And then the phage research has been developed in the Soviet country, and we are saying that it was kind of political alternative to the West. And it was the first line treatment for the Soviet Union. Of course, later it was, of course, developing the antibiotics and antibiotic research, but the phages really became very strong weapon against the bacterial infections.
So geopolitics also played a role in how phages became more researched and more developed in the Soviet Union as compared.
Of course, because scale of studies and the resources, financial resources, and the support from the government was really, really very big. It was a big contribution of the country to develop this field of the science.
We have a comment and a question from Suzanne, who's been a patient at the Eliava Phage Therapy Center. She says that, I must say, in the 21 years of having HS, I never had a treatment that worked as well and as fast as phage therapy, and that too without any side effects. She says that if I have a HS spot that's developing, I put on phages and within a few hours, the pain goes down, the swelling goes down. It's almost fascinating.
Very good. Thank you very much for this comment.
She has a question about the research. She wants to know that when you do when you do research on phages, do you now use patient control groups as well as the people who are being treated as part of the research?
No, we are not doing the clinic. It's kind of clinical trials. No, currently we are doing just case descriptions, case studies based on individual case. We are not comparing it with the control groups. Currently, we are not doing such studies. No.
There's a question from Sumantro Chatterjee. He wants to know that what is the ratio, or how much have bacteriophages, I mean, he says replaced antibiotics, but bacteriophages, as you've mentioned, predated antibiotics. So I think he wants to know that what is the ratio between the people who use antibiotics as the first line of treatment in Georgia versus people who use phages as the first line of treatment in Georgia?
You know, it's quite difficult to ask the ratio, because again, as I mentioned, you know, the patients, without going to the doctors when they have some minor complications, for example, throat infection or nose infection, or even wounds, you know, light wounds or not complicated wounds, they're using phages. So it's quite depends on the patient's decision what to use. But the ratio with the doctors, with the prescribed conditions, maybe it's, of course, it's a higher number of the cases which are treated by antibiotics. But I cannot give you exact ratio. Again, with the patients coming by themselves without prescription from the doctors, it's very high. And you can... we can estimate it by numbers. So we have about 50-60 persons per day in our diagnostic centers, and about 25, 30 out of 50 are coming by themselves without doctor's prescription. So this is quite a ratio. And those who are coming by themselves without doctors, most of them, maybe 90%, they're using the phages. But those who are, for example, are sent by the doctors where their antibiotic resistance, of course, we have cases complete antibiotic resistance and you cannot use the phages, antibiotics at all. And in this case, you have to use some alternative like phages. But in some cases, of course, it depends on doctor, what kind of decision doctor will make. Or combined, again, I mentioned about combined application, phages plus antibiotics, which has really very good, effective results.
Yeah, I think that answers the question that he had. Meera would like to know that are the research papers and data from the treatments and clinical trials done at the Eliava Institute over the last 97 years, are they available or accessible in English language?
Yes, actually, yes, it's accessible. We published twice, one internally at the Eliava Institute. It's a literature review. We have quite a lot publications in Russian, in Georgian during the Soviet time. And by help of our partners from the UK, we could compile, translate into English and publish books. And one of them, I think it's even available on the Amazon. It's a literature review after the clinical results of after the phage application in patients. And right now, we are time by time, we're publishing the case descriptions as well, yeah, in English. Yeah.
Okay. And you mentioned all the new case studies that are now being prepared. Those are all, of course, I assume, being prepared in English for global publication.
Absolutely. Yeah, they are.
Dr. Urmi Bajpai would like to know that have there been any COVID-19 patients who have been treated for their secondary bacterial infections with phage therapy that you would know of at the Eliava Institute?
No, at the Eliava, definitely no. In the world, I'm afraid I have not heard any.
We have a question from Abdullah Arif, who would like to know that can the phages at the Eliava, can they be given intravenously as well? Or is that something that is being developed at the Eliava Institute?
Yeah, it has been developed during the Soviet time. We had a couple of phage preparations for intravenous application. First of all, it was staphylococcal phage against Staphylococcus aureus. Also, it was against Pseudomonas aeruginosa. Currently, we do not produce phages for intravenous application. We have to transfer our production facility, and then we have to get the special approval for that. It's possible, of course, it is possible to use the phages intravenously for some complications. It's very interesting. We had the during the Soviet time, it was the clinical studies of more than 600 patients with the different complications where staphylococcal bacteriophage has been used intravenously. And it's really very interesting. It's published, by the way, in English. And it's quite an amazing results of phage application in case of sepsis, acute and also chronic sepsis, staphylodermias, furuncles, deep wounds. It's a long list of the complications that have been treated by phages intravenously.
And I think the application for that would be more in ICU applications, right? Where it's a very acute infection, which needs to be treated intravenously.
Absolutely, yeah, it depends on the medical status. And we had several cases in the US. It's also published. They used it in a very complicated case for Acinetobacter baumannii and the others as well.
Yeah. We have a question from Patrick Benedict, who asks that, do bacteria develop resistance to phages quickly? And how often are the 6 standard phage cocktails of the Eliava? How often are they updated?
Okay, thank you for the questions. So in general, the phages are not developing resistance so quickly. So especially so how we are working, we are selecting the phages which has very low frequency or mutations against bacteria, host bacteria. So we're targetedly selecting those phages which has very low probability. It's 10 to -6 or 10 to -7. So this is one solution. And the second very important solution that we are using phage cocktails, so mixture of phages mainly. And it's absolutely impossible to develop resistance for the individual component of the mixture. So this is another very important solution. As for the updating for the commercially available phages, it's very much depends. And the minimum time of adaptation, it's about 1 year, 2 months, 1 year, 3 months. This is the frequency.
So around annually they get updated?
Mostly, yeah.
We have a question from Suzanne who wants to know about the titer count of the phages in the cocktails. She says that some phage scientists in the US use titer counts which are 10,000 times higher than the titer counts being used in the Eliava phage cocktails. What is the reason for the titer counts to be lower? And is there a benefit from a lower titer count or a higher titer count?
Yes, we are, it's absolutely correct observation. We are using lower, which is 10 to -6, 10 to -7. And we know that this amount and concentration of phages work very well. So, and it's based on many years of observation and clinical application and experience. So why they're using higher titer, the question goes to them, not to us. So, but in our case, we considered that it is not needed to use the higher concentration of phages for treatment.
I think that's a really important point to bring out, that the treatment methodologies and guidelines and the procedures at the Eliava have been developed over almost 100 years of experience. And in many other cases, when people are comparing to treatments which are being done in other places, those treatments are in the process of still developing the procedures, because for them it's a new treatment. Here, all the treatments that have been developed, the procedures have been formulated over almost 100 years of experience.
Absolutely, Pranav. This is why I was mentioning some very important details, which is really should be considered, especially during the clinical trials, you know. So it should be planned in collaboration with the Eliava, because we have the protocols, we have procedures. In many cases, it cannot be standardized, for example, until for in the nearest future. But I think that the crucial role of Eliava is to participate together with the other partners in the well standardized, to create standards or procedures, exact procedures, how the phage preparation should be used in the different infectious complications. This is absolutely necessary.
We have another question, which is from Sumantro Chatterjee. He wants to know that is there a possibility to use bacteriophages in ICUs as preventive measures to avoid external infections in patients during their ICU stay? So I think this is more about ICU, preventive ICU infections. Can phages have an application there?
Yeah, in general, for the prophylactic purposes, our experience, I mentioned already, it was mainly for the intestinal disorders. The hospital-acquired infections, it's really very important issue. It's absolute nosocomial infections. It's absolutely very important problem for many hospitals, not only in developing countries, but it's in developed countries as well. So it's possible to use the phages, for example, very interesting application for decontamination purposes, for example, to decontaminate the ICU or medical settings with the phage preparations. First of all, to identify what is the target, what is the causative agent of the nosocomial infection or hospitally acquired infection, and then just clean the rooms or medical settings with the phages. Also, very interesting to use the phages with the ventilator-associated cases in the ICUs. So it's really very crucial and very interesting issue. Yes.
So this I'll take as the last question from the comments. This is a question from Raghav, who wants to know if there are internships, internship or training programs available at the Eliava Institute for people who want to learn more about phage research and who are studying phages as part of their microbiology.
Yes, this is very interesting, and every year actually we had twice already summer school at the Eliava Institute for the international students, international scientists as well. We had very successful 2 courses. Unfortunately, due to this situation this year, we postponed it. We hope very much to do it maybe late autumn, fall, or maybe in the winter. So it very much depends on the situation in different countries and in Georgia as well. It's the specific internships we are not providing by ourselves. So they should find some kind of financial support to fund the internship in Georgia, or they should be associated with some medical or university in Georgia. It's happening also to be associated with the educational, for example, universities in Georgia, and then have some practical or theoretical lectures at the Eliava Institute. So also very interesting, it's the collaboration. We are open to any scientific developments and collaboration with any countries, especially with India. I would be very happy to start and develop some scientific collaboration with the scientists from there.
Thank you so much, Dr. Mzia, for answering all of these questions. We've had you for more than an hour now, so I know you have a busy day. You're reopening operations again after the lockdowns, so I'll let you get back to your work and your routine. Thank you so much for joining us, for taking out the time and sharing your insights, your experience, your perspective. I'm sure this has been very helpful and very useful for all the people who are watching. And I think because we spoke about the internships, you can expect more people, more applications, especially from India, because I know a lot of students are tuned in and watching this. So you can expect some applications for the research training program for maybe next year.
Thank you very much, Pranav. I hope very much that it will be more and more people interested in the phage research, phage application. And again, Eliava is open to collaborate and to host the people who would be interested in more understanding of phage phenomenon, phage biology, and application possibilities. Thank you very much.
Thank you, Dr. Mzia. And thank you to everyone who's tuned in. Thank you for your questions, your comments, and thank you for your patience initially when we had a little bit of a technical problem. We will be back soon with another episode, so do stay tuned and keep looking at our Facebook, Instagram, and Twitter. We'll put out the information there. And thank you so much, Dr. Mzia, for being here with us.
Thank you. Thank you.